Thank you, Chris, and good evening or good morning, depending on what hour of the day it is for you. And thank you for the opportunity to share with you my first occasion to use electrical stimulation of this type on a complex wound. Now, this patient probably will take the award for the most complex patient you'll ever see. 86-year-old female, a diabetic with diabetic neuropathy, has both venous and arterial disease, has aortic valve disease, CCF, is allergic to almost anything you want to mention, and has lots of drug sensitivities. She has hypothyroidism, fibromyalgia. She's had a fractured hip. She has an iron and B12 deficiency. She has gout, diverticulitis, GORD, hernia, osteoporosis, recurrent UTIs, advanced thoracic degenerative pain, arterial fibrillation, polymyalgia rheumatica, shingles, and carpal tunnel syndrome. So, boy, is this a complicated patient. Now, I was introduced to her after she'd had a very, very long time of a non-healed wound, and the various people who've been looking after her had used all sorts of dressings and whatever. And in particular, this was a very, very painful wound that had been unhealed for 16 months. As typical with most general practitioners, she'd had multiple antibiotics. She'd been treated as an inpatient, as an outpatient, hospital in the home. She's had negative pressure and various other dressings. She's had lots of procedures, aortic valve replacement. She's had laser treatment of her short saphenous vein. She's had vascular stents, bilateral varicose vein surgery, and she's on an absolute minefield of medication. Her wound was 4 by 3 centimeters and very, very sloughy. It was very thick, tenacious slough. As part of the way that I assess a patient, I do things like a mini nutritional assessment. Her score was 15.5, which is really considered as malnourished. So one of the first things I did was to incorporate some supplemental treatment with L-arginine to try and improve her nutrition. Also did a Braden scale on her. And again, a Braden of 14 makes her at moderate risk for pressure injuries. One of the problems was she has difficulty sleeping in a bed. She mostly sleeps in a reclining chair. So to initially remove the slough, I used a product called Ergo Clean. And once it was, in fact, all clear of slough, we then started Ergostart. It did improve over the next few months, but then deteriorated, and the pain became extremely bad. So after I was informed about this new device, after discussion with the patient and family, there was a decision was made to start her on it. So this is the wound when we first dealt with it, and it had tenacious slough. And once we used the Ergo Clean, it did a very, very good job of cleaning all of that slough out. And then you've got quite a nice granulation base of the wound. This is months down the track, and we tried various things, and it wasn't going all that well. So this is on day one of when we first started with the Accel Heal device. And again, very simple to use. The dressing is held on with a non-woven hyperallergenic tape. And again, as you were told, the important thing is, because we have to use some compression, is to make sure that you bring the wires of the device through the compression so there's no actual compression on the wires to minimize any pressure damage. This was day 7, and the difference, and if we go back, 4.4 centimeter by 2.2 centimeters with a vascular scale of 5 to 7. On day 7, the wound was 3.2 centimeter by 1.7 meter. Quite a very, very good improvement in size. But what was critical was that her VAS score went from 5 to 7 to 0 to 1. So So it made an enormous difference in her pain. Then again, a week later, we see the wound continues to improve in granulation quality. The use of this device resulted in a significant reduction in pain and improvement in wound healing. There were no other significant issues with its use, other than you need to be careful when applying compression over the device. The use of the device to deliver electrical stimulation has a place in the management of difficult wounds. Results from this very first complex patient indicate that the impact of pain reduction in itself will lower stress, and this in itself assists in wound healing. But we observed through this time that the pain reduction was very significant, as was the wound healing. Unfortunately, this lady, because of one of her comorbidities, her hernia deteriorated and she needed to go to hospital for some surgery. Unfortunately, while in hospital, she had a fall and fractured her arm. So she was unfortunately lost to follow-up. I was impressed with how simple it was to use and how effective this was in treating this patient. Thank you.